Hello everyone, I'm Kibin Alleyne and today is Tuesday, April 18th. You are now watching Open, a program bringing the Bronx and New York City straight to you. Don't forget to stay connected with us via social media at BronxNet TV. It's a disorder that is affecting about 1 in 36 children in America. Across the country, health professionals acknowledge autism spectrum disorder during the month of April. Joining me for discussion on this disorder is Neuro-Developmental Pediatrician from Montefiore, Dr. Heidi Shulman. Doctor, thank you so much for joining me.
My pleasure.
Now, as I mentioned, according to the CDC, about 1 in 36 children were identified with autism spectrum disorder. Can you explain what it means to be diagnosed with ASD?
Sure. So at its core, and we often talk about the core symptoms, autism spectrum disorder is a social impairment that impacts function. And so the criteria are laid out in the Diagnostic and Statistical Manual. We're at number 5 at this point. The definition has changed over time. And basically, there are 3 required social communication impairments. And there are a second set of required symptoms related to restricted and repetitive interests and behaviors. And so in order to meet the criteria for an autism spectrum disorder diagnosis, the individual must meet all 3 social requirements, including the impact on functioning with peers, and also have at least 2 out of 4 of the restricted repetitive behaviors and interests.
Now, I understand that it's usually children who are diagnosed, but, can an adult be diagnosed with ASD?
So definitely, an adult can be diagnosed. I would say there's a general rule of thumb, doesn't always apply, but that more severe autism spectrum disorder presentations present earlier, and so will generally be recognized in very young children or children who are, meaning toddlers, preschoolers, or children who arrive in school and are having difficulties in the school setting. The milder presentations, however, people use the term camouflaging. The definition of autism or mild autism has changed over time. And so for individuals who have normal cognition, normal language, and who recognize and that they have social challenges, the diagnosis is something that they may come to embrace and realize later. And there's definitely a trend toward that recently.
Yes, I've definitely noticed, which is why I wanted to ask. And does that kind of relate to, I guess, the idea of like when people say, oh, I'm on the spectrum? Can you just elaborate like what it means when people say that?
The name of the condition is literally autism spectrum disorder. And in many ways, many diagnoses are a spectrum in the sense that there are milder presentations, more severe, and things in the middle. But in many ways, autism is the spectrum. So when people say they're on the spectrum, they are referring to the fact that they have social impairment that impacts functioning. If they can articulate that they're on the spectrum, it generally means they are verbal. The spectrum is wide. The classic saying being, if you know one individual with autism, you know one individual. Everyone is so different. And the spectrum ranges from individuals who are nonverbal and remain nonverbal for life, who are inattentive to other people in their environment, who have unusual behaviors and interests that are evident to everyone, to at the other end of the spectrum, individuals who are fully functional, but identify and recognize that their social weaknesses impact their functioning.
Now, can you tell me about the autism program Relate?
Okay, so In the 1990s, I know it sounds like forever ago, the program here at the Rose F. Kennedy Children's Evaluation and Rehabilitation Center at Montefiore was an early intervention program, and we have always had a diagnostic mission. And that was an era when children, a diagnosis of autism could not be made until 3 years of age. And here we were seeing 18-month-olds, 21-month-olds who were being referred to the newly formed early intervention program in 1993, 1994. And they were here because they weren't speaking, they were very picky in their eating, they were walking on their tiptoes. And we were experienced with autism when we would look at these little 20-month-olds and say, this child looks like they have autism. And our diagnostic mission drove us to basically say, this is an age at which we want to pick up on these social and communication difficulties because early intervention can make a big difference. And so the Relate program was formed in the context of striving to make an early diagnosis, whether or not the referral had been for concern of autism. And that's an important point regarding access. Autism diagnosis leads to very specific evidence-based interventions, often offered only to individuals with autism. So the Relate program was a specialty and is a specialty program for diagnostic clarification of autism, especially in young children, but followed thereafter.
Now, I want to talk a little bit more about, your work that you're doing to improve access. You mentioned that briefly for those with autism. Can you just talk about, how it affects those in underserved communities and how it may differ from somebody else who is maybe in a more privileged community?
So I was highlighting that a diagnosis of autism, when warranted, opens the door and access to evidence-based treatments that have been shown to make a significant difference in the lives of individuals with autism and their families. And so getting an autism diagnosis when it is warranted is a very important opportunity. It's really important to recognize that the systems that serve children with developmental delays, such as the early intervention program, the school district via the Committee on Preschool Special Education and the Committee on Special Education, those are not diagnostic systems. They offer services for children when a need arises. A diagnosis refers to, what is this? What do we call this? And that generally requires access to another system. Medical systems and medically based systems give diagnoses. A diagnosis of autism can be made by an MD or a psychologist, and it requires access to those systems in order to get that diagnosis. And so it's not been unusual over the years that we will see young adults graduating from special education services in the school district who have been recognized as having significant needs, but may never have gotten a diagnosis along the way. Things have changed, and that is a much less common scenario because of the awareness of autism. But the idea is a young child, in order to get an autism diagnosis, somebody has to express concern about, is this autism, as the quickest path to a diagnosis. Recognizing here at the Rose F. Kennedy Center at Montefiore in the Bronx, that population I spoke of that we saw in the 1990s, where the child wasn't referred for concern of autism, but because we know what the early signs of autism are, we made a diagnosis. highlighted that one way to increase access is to do what we bring our autism expertise to the front door, meaning there isn't a need for someone to be referred here to this center with the question of, does my child have autism? Or the general pediatrician's concern, does this child have autism, in order to be evaluated for autism. We evaluate everyone who comes to a program like this. We see 8,000 individuals a year, and every one of them is looked at through a diagnostic lens of, is this autism? If it is, let us document it. Is this not autism? Because these days, parents or others may refer children with different presentations, and we clarify, this is not autism. Instead, this is a learning disability. This is language impairment. This is attention deficit hyperactivity disorder. So times have changed. People are quick these days. Autism is a household word.
Right.
And parents, grandparents, teachers, individuals on the subway or in the street may raise a question of if a particular child might have autism. And so part of our work is to say, this child has a set of weaknesses or needs, but these either are autism or they are something else. And what is that something else is part of our diagnostic mission, to give parents that information to allow them to advocate. So access is about breaking down barriers. Mm-hmm. And so this concept of bringing our autism expertise to the front door is an important barrier that is broken down at this center. And I would say other approaches throughout the country are to make obvious diagnoses of autism when they are warranted, without additional testing beyond what is necessary.
All right. Well, Doctor, I want to thank you so much for, joining us and educating everybody on this. It was a really important topic. So thank you so much.
My pleasure.
If you would like to keep up with Montefiore and all of their efforts, please go to their website at www.montefiore.org or follow them on social media at Montefiore Peds. Don't go away. We'll be back with more Open right after this.